All right, good morning, folks. So this is an unplanned live, as sometimes what happens, but this is something that is extremely near and dear to my heart. And so I wanted to take a minute and really talk about something that I just became aware of. So yesterday marked the 1 year anniversary of us being able to bring my granddaughter home from the NICU. So as many of you guys know, my grandbaby was born at 1 pound. She was born at 26 weeks, 1 pound, and with all the cords and all of that good stuff, she was 1 pound 4.5 ounces. They're saying roughly probably 1 pound 3 ounces total birth weight for my granddaughter. And in Kingsport, Tennessee, there is Holston Valley Medical Center has a level 1 NICU center, which is phenomenal. When I tell you that the nurses, the staff, the doctors, the surgeons at this location are amazing, they really and truly are. And so this hospital used to be part of Wellmont, right? Wellmont is who used to own this hospital, along with hospitals in Johnson City and hospitals in Bristol and so forth and so on. And Ballad Health at some point, I don't live there anymore, so I couldn't really tell you, but Ballad Health at one time or another purchased Wellmont Health Systems. And so they have hospitals and doctors' offices across Northeast Tennessee and Southwest Virginia. Now, if you know anything about this rural area of those two states, they're not very flourishing. They're not very highly economically driven. Your options are not the same. There's no such thing as a public hospital that doesn't turn people away like we have here in Atlanta. There just aren't the same options available. And for a level, so if you live in Bristol, your options for a high class, like really competent NICU center is to go to Kingsport, to Holston Valley, or to go to Johnson City Medical Center. Now, I will tell you this: Johnson City is going to have more traffic. It's going to be more difficult to get to, and it's a little further away than in Bristol. Good morning, Melvin. Pam. Hey. So here's the thing. So recently, I was just home, as some of you guys know, and my mom was put into the hospital as well. The hospital that my mom was put into was also part of Ballad. Now, let me tell you some distinct differences from the last time I was in the hospital with my mom when she had her heart attack and then later on her stroke, and now when Ballad is there. So when my mom was in the hospital, they gave her, it wasn't until the third day that she was there, maybe even the morning. No, it was actually the fourth day that she was there that they came in and finally offered to change the sheets. There were no towels. There were no washcloths. There was no soap in the shower anymore. So we had to ask for soap, and they brought us like the little bitty ones. They don't keep those filled anymore. So in other words, what you see is a hospital that is more focused on keeping costs down for a greater profit margin. So we all know that there's no lack of profit margin in hospital bills. We all know that what you get charged for your prescriptions when you're in the hospital is significantly higher than what you get charged when you go to Walgreens or CVS and pick it up and take it yourself at home, right? But what you see is a hospital and a hospital system that is more interested in their profits than they are people. My grandbaby was born at Holston Valley Medical Center, and I'm extremely passionate about this because without them, without those doctors, without those nurses, without those surgeons, my daughter and my granddaughter would probably not be here. Like literally would not be here. You can look on my page and see the post. Bella was 1 pound and 3 ounces. Okay. And so I learned a few weeks ago that Ballad Health was considering shutting down our NICU center in Kingsport and moving all NICU services to Johnson City. So what that means, folks, is anybody that's in that rural Kingsport area or in Bristol have no choice but to go all the way to Johnson City. If you were to go to Abingdon, you're now crossing over state lines because Abingdon is in Virginia. So the thing about this, here's what gets me about this. This is what I don't fucking understand. I don't understand how profits take priority over people. Some of the nurses in our NICU hospital in Kingsport drive all the way from Rogersville already just to work there. Just to work there, just to do what they do, to work 12-hour shifts, to take time away. Like they already do that. So I reached out to Ballad, let me see the day, on October 26th. I sent them a message. Hey, everybody. I sent them a message and I said, hello, I'm concerned that you are considering losing the NICU unit at Holston Valley Medical Center in Kingsport. My granddaughter was born at this facility August 2017, weighing just 1 pound and 3 ounces. Moving all NICU services to Johnson City would put the people in this region at a significant disadvantage to get the care that they need for their babies. The staff at the NICU is incredible, not only because of their expertise, but because of their hearts and the dedication to what they do. Money cannot measure what they do, and profit is not more important than life. Please respond to this message, as I'm extremely concerned about this issue, and we would be willing to start a petition to stop this from happening. The response that I got back was, hello, Ms. Cook. Thank you for reaching out to us and sharing your story. We hope that your granddaughter is growing and thriving now. Since Ballad Health came together in February, our integration team, together with physicians and community leaders, have been carefully considering how to best use our resources to provide the highest quality and most accessible care to the people of this region. The goal of this work is to ensure our patients have the best health outcomes possible. We know that that centers with higher patient volumes have been shown to produce better results, and we are taking this important fact into account as we evaluate our services. Supporting the health of infants and children in our region is a major priority of Ballad Health, and we have made significant commitments under our merger supervised by the state to reduce infant mortality, reduce the blah, 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 blah. I give a shit. We have also committed to spending $27 million over 10 years. See, all of this right here is fuckery that I don't care about. Like when you say all of that, what you were trying to do is justify for me taking an accessible center for the people in this region. You got folks in this area that don't have vehicle and don't have transportation. There's no okay, so let me break this down for y'all. In Atlanta, we have public transportation. We have things that are accessible. You don't have this. If you live in Kingsport, if you're not in the medical field, if you don't work at Eastman, you don't have a good job. Like the idea of the money that you make is little to none. It's the same thing in Bristol. It's the same thing in Johnson City, except Johnson City has ETSU. This is not an affluent city with tons of resources for the people that need this. I personally saw the moms and dads that were in this NICU unit. They were oftentimes either young or they were oftentimes middle to lower class in terms of their income. They don't have the ability in the time that these babies are born to pack up and drive 30 miles to Johnson City. They don't have that ability. And it really pisses me off that we're focused on this. You want to know why America is in the state that it's in? You want to know why people in other countries can be nicer and they can be more calm and they can be more kind? Because they don't have to worry about fucking living. They don't have to worry about finding the finances to be able to pay for all the medical bills that come into you. You want to know why most people's credit is jacked? It's because of their medical bills. Most people in this country are one significant illness away from being broke or homeless. And you have babies that would not be here without this facility. And it makes me angry. It makes me angry that you want to talk to me overseen by the state. Fuck the state, honestly. And I know that's not the most politically correct way to say it. And maybe I should be nicer if I want people to listen. But truthfully, this is what you have to understand, folks. These are lives, and these are lives of babies. I do not understand. Shame on you, Ballad Health. Shame on you. The distance that these nurses should have to travel to try to do their job, to try to live their purpose, to try to save lives should not be greater. Are you giving them pay raises? Are you supplementing their, and what about the extra hours that it takes away from their families? They are already taking 12 hours per shift away from their loved ones, and that's not including their commute time. So now we're going to double their commute time for many of them. And then you don't want to change sheets. You don't want to provide towels. You don't want to provide washcloths. You don't want to provide whatever you want. You want to make it. I can't bring you the medication that's in prescription bottles for you to verify. I can't do that. And you let me take medication that I already have. No, I have to let you give it to me out of your pharmacy, and you charge me 3 times what it's supposed to cost me. Shame on you, Ballad. Shame on you. And this is especially in this region of the country. This is not a super affluent community. What is wrong with you? They want to create pediatric emergency rooms in Kingsport and Bristol to complement the one available in Niswonger. Niswonger is the one that's in Johnson City. Here's the thing, folks. I don't care if you give me, let's just say you give me a children's emergency room. That doesn't do shit if you don't have a NICU unit that is qualified to take care of babies that are born at that area. Heather, I cannot. So Heather, who you see in this live right now, happens to be the nurse that brought Bella out of surgery. That picture that's posted on my page today, she stopped for 2 seconds and she let me take that picture of my grandbaby. The idea that they're going to close this NICU unit down, I just cannot stand it. I cannot stand your choices. I cannot stand how you take lives and compare them to your bottom line. I cannot stand that you don't have the idea, the thought that if you have the ability to save lives and it makes your profit margin 10% instead of 50%, then that is what you do, because that is what humanity is all about. Instead of lining your fucking bank account, because I would love to get a list of all of your board members and find out what your salaries are. That's what I would love to find out. How much are you getting paid to take a facility away from people who need it? There aren't any empty beds in this NICU, folks. This is not a hospital that there's only 3 babies in. This NICU unit is packed. Packed. So what do you do? Obviously, there's a need. This is not a case of us saying, oh, well, this NICU unit barely has any babies in it. No, that's not the case. That's not the case. This is a NICU unit that is full to capacity. So what are we doing? Shutting it down. Shame on you, Ballad. Shame on you. I am heartbroken and I'm angry and I don't know so what do you do? I don't live there. You know what I mean? So maybe they don't give 2 shits about what I think, but what do you do? Like, I think this is the frustration that people see in this situation. This is the frustration that people see in politics. This is the frustration that we see because you see things that we know are just wrong on a human level. It's just wrong on a human level. And what do you do about it? How do you make people do what's right? How do you make people have a heart and compassion and morality and kindness? How do you make people give a fuck about people's lives and their babies and their children? I don't get it. I don't get it. I don't get it. I don't get it. So this is the one thing that I will say, folks. This is why we have to, I don't know what we have to do, to be honest. Because like in my daughter's case, this wasn't a situation of like neglect that caused the baby to come early. It wasn't a case of not doing anything right. Literally just the flow of the placenta stopped happening to the baby. So there was no choice. Hey, good morning, everybody. So the Ballad Health is a healthcare system that took over Wellmont, okay? And they have stripped the hospitals and the facilities down. When Mama was just in the hospital, you know, you go into a hospital room and you expect for there to be soap in the soap dispenser in the shower. You expect for there to be at least a washcloth to wash your face, maybe some towels or whatever. You know what I mean? Just if you're going to be there overnight, you just would expect those things. We didn't have any of those things. They didn't even come in to change my mom's sheets until the 4th morning we were there. That's it. The day that we were being discharged, we were like, well, what now? Like, why now? And what's got me upset this morning is the NICU where Bella was born in Kingsport. They have made the decision to move all of those NICU services to Johnson City. Shelly, you know what this area is like. Can people who are on the outskirts of Tennessee and in those rural communities on the outskirts of Kingsport, can they, in a situation where a baby is about to be born, do they have time to drive all the way from Kingsport to Johnson City? Like the folks in Bristol, what happens if all of those babies now have to only go to Johnson City? So between those 3 cities, you're going to have one level 1 NICU center. How many babies, how many potential babies and moms is that going to cost? And I reached out to Ballad Health on October 26th, and they gave me a bullshit political response, and I'm angry. I'm angry. Some of these nurses already drive from Rogersville to Kingsport to work, so now you want to make them drive from Rogersville to Johnson City? There's no consideration. There's no consideration. It's all about the money. It's all about the money, and I'm angry. Because there's not enough money that accounts for the lives of babies. There's not enough money that accounts for the lives. I don't understand. So shame on you. You all join me in telling Ballad Health, shame on you. Yeah. So anyway, I don't get it. I truthfully, with all my heart, don't get it. So I'm going to go so I can get my shit together. I have a meeting in like 14 minutes. I don't know what to do. I don't know how to make hospitals stop acting like you're a fucking tech company. You're not. Your goal is to save the lives of people. Why do you think Aetna just got sued and the plaintiff just got millions of dollars because they denied treatment for cancer? Check that out. It was in the news just yesterday or the day before. We have to get better. We have to stop turning people away. We have to stop turning people away for the fucking dollar. So anyway, I'm going to go. You guys try to have a great day. Heather, I love you guys so much. Anyway, be amazing, be light, be love. I'll talk to y'all later. Peace.